Hi everyone, so I'm going to take you through a little lower back release video today. So it's just going to be focusing on the lower back and things that might mean that the lower back is getting overloaded, inflamed or stiff. I'll be adding on another video soon about how to strengthen muscles to help support the lower back, but this will just be focused on easing things, increasing movement, encouraging that movement of blood flow to the area and decreasing pain and restriction. So let's get started. We are going to first come to lying on our back. So I'll just move my arms up so that you can see my spine there, but just have your arms by your side with palms facing up to the ceiling. And from here, I've got my feet in line with my hips there, knees bent. I've got that little space underneath my spine. So to start off with, I'm just going to encourage some movement into that lumbar spine, inflection and extension. So what I'm going to do here is inhale to prepare, and then on the exhale, I'm drawing in through that pelvic floor, lower abdomen, and tucking my tailbone under, flattening my lumbar spine into the mat. And then I inhale, tilt the pelvis the opposite direction to reach that tailbone deep into the mat and recreate that space under the lower back. So exhale, flatten, inhale, lengthen. Exhale, flatten, inhale, lengthen. So if you're feeling really sore through that lower back and you find that it's quite stiff getting up first thing in the morning, you might want to do these ones first, so lying down, before you add any gravity and compression forces through the spine. So loosening things up without any gravity going through the spine first can be quite helpful here. All right, we'll turn that into a little roll up. Now, depending on how stiff you are is going to determine how high you're going to go with this. So same initial movement, exhale, draw in through the tummy, flatten, but then we're lifting the pelvis off. Now you might just want to go a couple levels higher to lift that bottom off and then reach back. Or if you've got a little bit more movement, you might want to go all the way up and rolling down, but thinking lowering from the top of the spine, middle of the spine, lower spine reaching long. Exhaling on that lift, drawing in through that belly, just as high as you're feeling comfortable. And we inhale at the top, then exhale, re-engage that core. That's going to support your spine throughout the movement. So think about tummy on the way up and down. All right, let's go 3 more like that, then we'll move on to the next exercise. I'm just going to do little ones today, so not all the way up. So yeah, just take it in whatever range you're feeling good. Going towards that barrier of pain, but not really pushing through it, not feeling apprehensive. Alrighty. Then from there, I'm going to take my feet and knees together. Arms by the side. I'm just going to take a little rock side to side through those knees. So this is just adding a little bit of rotation gently through the spine, joint lubrication, blood supply, nerve supply. Again, whilst the spine is not under any compressive forces when we're upright. So these are your first starting steps if you're feeling really tight through that back there. And then if you're feeling okay with that little movement, that little rock, take the feet slightly wider, and then you can go into a bigger rock through there. So that's just going to really enable that hip to lift up. feeling quite sore, we're going to take this into rolling onto our side to get up carefully, and then push yourself up. Sometimes just trying to sit up in that supine or lying on your back position can be a little bit intense if the back is quite sore. So from here, we're just going to be sitting with our legs crossed, and if that's uncomfortable, you can have your arms out wide, legs out wide, out long, or out in front of you, just whichever way you need to feel like you're sitting nice and upright. You can also add a cushion or a roller under your hips to elevate your hips if you're finding you're quite tight through the hamstrings and that's preventing you from sitting upright here. So from here, I'm just going to go into a side stretch. So I'm reaching one hand out to the side and bringing my other arm up and over. Now, from here, I'm turning my nose towards the ground just to take any strain out of the neck, holding it to the side here. Sometimes that can be quite tight. If this top shoulder is not liking that reaching over, so I'm quite hypermobile through my shoulder, so I'm just going to go hand behind my neck and reach over from the elbow. So we're aiming to keep that back hip down and create space between the lower rib and the hip there. So those lateral trunk flexors, or your side benders of your spine, that's what we're opening up here. And a couple more breaths here. Big breath in and out. One more there. Big breath in. Big sigh out. And now we're taking that top hand and reaching it slightly in front of our body. So it's just going to take us into a little flexion rotation movement here. So it's just going to stretch that side of the body slightly differently. And we're supporting ourselves with our hands. Now you may be up here. You may even be up on the knee if you've got that much restriction of movement. Just go to wherever you're feeling a bit of a challenge of your stretch, but you're not feeling like it's aggravating anything or really bringing on that familiar pain. It should be edging on discomfort, but nothing that's going to make you really weary or set things off. And if a movement is getting a bit intense like that you're going through, just avoid it if it's feeling like it's going to make things worse. Like just use your intuition for this. 2 more breaths. Last one. And opening up and back to straight. And I'm going to reach over to my second side. Arms coming over again. So you can hold here, look down towards the mat there. Don't mind me, I just spilled coffee on myself this morning. Haven't changed my jumper yet. And so we're keeping that hip down if we can, and just feeling that side of that rib cage really open out. Hand behind the head if that shoulder is bothering you with that reach over. But if that feels nice, you can hold there. Breathing into that side of the body that you're stretching. Let's go 3, 2, and 1. Lifting up there and then reaching that hand forwards now. So I'm a little bit more restricted this way, so I'm not going to look like I'm going as deep into the stretch here. So yeah, if your hand's closer to the middle, you won't be rotating quite as much. And I'm just trying to keep my shoulders nice and open, nice and square. Two more big breaths. Big breath in and out. On that out breath, I'm just going to see if I can go a little further. Last one, big breath in, big breath out. And opening up tall. All right, we're going to take this into a forward fold here. So reaching the arms in front of you, maybe here, you may be here, you may be all the way down on the elbows. If this leg position is uncomfortable, you may take it into a little knee bend with the knees wide and work from there. Or if you've got a little bit more range, you may want the legs out in front and you can come into this little fold here that's going to stretch the back of the hamstrings as well. So just take it where you're feeling good here today. I'm going to take it into this little kneel and I'm just going to fold forwards there. Now, if you're still in your seated posture with your legs crossed and you're reaching down, just support yourself and breathe. Now, what happens here when we're reaching forwards, if our spine is rejecting our forward movement and that's where we're feeling a sharp twang of pain, that's because we've had that injury to the back, we've had a lot of inflammation go around that area, which has created the muscles to spasm. And that's meant that when we do move slightly forwards in that direction, we've created little pain pathways from the brain to our back to send a little jolt of, no, don't do that. So it sends a message to the muscles to spasm, to restrict our movement. So by doing this, and gently coming into that fold to that edge of where you feel like, oh, that's not going to be very nice, and just breathing into it and then slowly moving a little bit more forwards, breathing into it. What we're doing here is we are trying to rewire that circuitry that the body's created to protect your spine, and we are just telling the brain that it is actually safe for us to move carefully and gently into this movement for now, and that nothing disastrous is going to happen. And so we don't need that very severe protective reaction to happen every single time we go for that little forward bend. So by taking these breaths, easing into this movement, we're going to reprogram that severe muscle spasm reaction. Because we're not in any danger here, we're not lifting anything heavy, we're not adding any twists, we're not creating any force, nothing high impact. We're just encouraging the spine to do a movement that's completely normal for it. Let's go 2 more breaths there. If you're doing this cross-legged as well, you're going to get a little stretch through those glutes. Last one. And coming up from there. All right, we are slowly coming into our little cat stretch here. So hands directly under the shoulders, knees directly under the hips. From here, we're going to arch that spine up, tuck the tailbone under, and then releasing. Tucking under, releasing into extension, making sure we're not sinking into those shoulders, we're pushing out of the mat still. Tucking under, draw in through that belly, and release. We're here for 4. This is a really nice gentle way to go into that extension too. If anything's pinching in that extension, just go until you feel like that's aggravating. You don't want to push it into that aggravating extension movement. Last one. All right, take those knees nice and wide, sit back towards those heels. We're just going to take the hands out to one side here. So right hand down to the right side of the mat, left hand over right. We're going to sink that left hip back towards that left heel. And if we can, we're going to get a little drop through that right shoulder there. And breathing into the left side of the body. So we're stretching out that whole left side of the body there. Really breathing into that side of the rib cage. Now, for some of you, it might be worthwhile having a look at my videos on thoracic spine mobility too, particularly the roller ones. They're going to be quite helpful for anyone that's getting stiffness, tightness in the lower back, because often there's a bit going on with stiffness in the thoracic spine, and when that's not moving very well, our lower back and neck try and compensate for that lack of movement, and that's little areas and pivot spots in the spine get overloaded and our muscles try and protect us. Coming around to the left side, bringing that right hand over left and dropping down through that right shoulder, right hip sinking back towards the right heel. Now this may look totally different. You may be here, you may be right down, just wherever's comfy for you. 2 more breaths there. Last one. And coming back to the center, walk those hands towards you. Now we're going to have a little stretch through our hip flexors. These can get really tight throughout the day if we've been sitting for long periods. So with our legs flexed, our hips flexed, and by having that tightness, it can sort of pull you into this little forward posture, creating extra strain on the spine there, and also switching off through your glutes. So you might want a little cushion underneath that planted knee if you're a little bit sensitive in the sort of kneeling posture here. I've got my leg forwards, pelvis is square, my hips are level, and then from there, body is upright. I'm just going to lean forwards into that front leg. And then from here, little tuck under of my tailbone, pushing that pubic bone forwards. That's going to really open out the top of my hip. And if you need any more stretch there, you can lift that same side arm. So in this case, my right arm is elevating, just creating that little extra reach through that hip flexor. Hip flexor here does attach onto the lumbar spine. So if that's tight through the front of the hip, you will get pulling through the back as well. So that's another reason this stretch is really important for helping unload that back there. And opening out, I get enough stretch without the arm, but by all means use that if you find it helpful. And so this is a really nice way to stretch as opposed to some of the classes and things that you may have done in the past where they teach you to really sink into it. You do feel a nice stretch there, but see what happens with my back there. I'm crunching into that lumbar spine. I'm really compressing all of those joints. So by just going for lean forward and using the pelvis, we get that isolated hip stretch without compromising our back here, which is very important if your back is already feeling a little bit grumbly. Great work. Releasing there. Leg down, other leg forwards, up nice and tall here. Go for that little lean forwards. And then little tuck under, or I'm much tighter on this side, so I'm not even going to lift my other arm. But if you feel like you need to, by all means, go for it. If you need that extra stretch. Remember to keep that pelvis tucking under. We're here for 5, 4, 3, 2, and 1. Backing off there. Have a little seat here. You can do this one sitting on a chair as well, but I'm going to stay down on the mat just for the sake of ease today. So I'm going to cross my ankle across my opposite leg and bring my heel towards me. I'm wanting my back up really tall, so we're aiming to stretch this right glute here. Just breathing there. Holding that stretch. Up nice and tall, feeling like you're rolling forwards on those sit bones. That's going to increase that stretch in here. And take that little rock side to side there. And then dropping that foot down, other leg coming over, bringing it in, up nice and tall, little tuck out of the tailbone this time, so like you're rolling forwards, on those hips, straighten the spine. We're here for 5, 4, 3, 2, and 1. Little rock. Nearly done. We've got a little rotation to go seated. And relaxing. So those tightness in those hips can really contribute to laziness through those glutes and deactivation of the glutes, which also increases that load through your lumbar spine. Just going to take this into a little rotation. So you might want to just go arms crossed. I'm going to use my hands on my knee there. So you can also be in this position if that cross-legged position isn't available to you. And I'm just twisting my spine and holding. You might want to back out of it a little and move slightly into it. So this is just adding that rotation now with compression forces through the spine. So with that gravity acting on the spine. So this is functional movement, because this is where we are going to be doing most of our movement from, not lying down. And gently coming back through center and coming around to the other side. You will feel naturally that you're more restricted, particularly in rotation, one side to the other. So I tend to rotate towards my dominant side. I find most of my patients and clients also do, because we're used to reaching that side forward, pulling on that side, dropping down on that side from carrying and lifting. So I'm a bit more stiff on this left side. I'm going to come out and back gently. No pinching pain. Excuse me. And coming back through center. And we are all done for today. I hope that gave you some relief from your stiffness in your lower back. And please leave any comments or feedback. I would love to hear from you. And I'll see you on the mat again soon. Bye.